So just to repeat, we have a new phone now for our next section of our video. Pregnancy is a tridoshic experience, Vata being increased because of the location, Pitta being increased because there are two hearts, two bodies, there's lots of heat, and Kapha being increased because Kapha is all about growth. So, labor and delivery is Vata aggravated. It's exhausting, it's tiring, and it leaves the mama with emptiness. Because where there was fullness, there is emptiness, and emptiness is Vata aggravating. So we'll talk about how to soothe that in a moment. So care of mama after the baby is born is very important because she is very delicate. The mother should prepare for the time so she is aware of what to expect with labor and delivery. And mama must heal because she has wounds and the tissue in her peri area has been damaged and maybe some tearing and some stretching and things like that, and her uterus needs to clamp down, and so she needs to heal. She must get rest. Ayurveda strongly recommends that mother have other mothers around her and family around her to reassure her, to support her, to assist her with lactation, and to cook food for her. And food should be cooked and sweet and not necessarily sugar sweet, but grains and foods that are, and some sweetness as well though. Grains and legumes that are cooked very well, vegetables that are cooked very well. And she should receive regular massage in the Vata region of her body, all over if possible. And after massage, her lumbar area should be wrapped for 2 months. She should have some squeezing. Because when there is emptiness, Vata gets aggravated, and squeezing soothes Vata. Hugging, squeezing, tightness is what calms Vata. So she should have some nice pressure on her uterus so it clamps down and soothes. The baby should also get a regular oil massage. When I went to visit Banashri recently, she was using this oil. It's a Himalaya brand, nourishing baby oil, and it says winter cherry, and some of you may know that winter cherry is ashwagandha. So she was using this to massage Arjun before she bathed him, and then after that he slept he fell asleep, and I thought, well, the ashwagandha certainly must have helped with him sleeping, but it was a very nice oil. She just gave him a nice oil massage, yeah, pass it around, and bathed him, and oh, thank you. You can take a look at that. I just printed that out for a visual. So daily bath for mama, daily oiling and bath for mama, and regular oiling and bath for baby as well. Lactation is very important, and the milk depends on the quality of the food that mom's eating. And baby eats what mama eats. This is not a sort of, a kind of, but this is exactly. Baby eats exactly what mama eats. So I was at a lecture at a Nama conference quite a few years ago now. I don't even remember how many years ago, but it was by Sarita Shrestha. Can't say her name. She's from Nepal. Have any of you heard of Sarita Shrestha? So she is an Ayurvedic doctor from Nepal, and she comes to California about once a year, and her area of expertise is women, pregnant women, and the health of women. And so she was talking about this particular topic that I'm talking to you about, and what she said at this point was, mama should not eat greens. If mama eats greens, baby poops green. Sorry, I like to mimic the accent. It was very fun. Anyway, yes, so it's very hard for baby to digest greens. So mama shouldn't eat greens, especially no raw food during this time. Only cooked food and no cooked greens even. It's too rough and too hard for baby to digest greens. And I don't really know when mama can start eating greens, but I would guess 6 to 8 months maybe she can start eating greens. But even then, if baby gets runny stools or green stools, she should just be aware of that. There should be a calm environment, good light from the sun. Mother should rest during the day for the first several months, and the baby should be protected from fear, cold, and wind. The mother must be cared for, and she should be assisted for at least 30 to 40 days. Literally, just everything done for her for about 30 to 40 days. She should have food prepared for her, she should have help, and she should learn from other mothers. Okay. There can be, mothers and babies' clothing should be fresh smelling and clean. You can use herbal amulets that are fragrant and supportive. Keep the child safe and never frighten the baby. And I've learned from Banashri recently, don't ever wake a sleeping child.
Yeah.
I was getting ready to leave and I said, should we wake him so I can say goodbye? She goes, no, never wake a sleeping child. So that is basically what I have to share with you. Why don't we turn that off and we can talk about questions.